For the first time, the CDC confirms a person infected with bird flu in the United States has acute respiratory symptoms. It is the third human case tied to the dairy cattle H5N1 outbreak and the second case in a dairy farm worker in Michigan. Federal health officials say the latest person with the virus had direct exposure to infected cattle. They say there is still no evidence of human-to-human spread. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF. Good morning. Good to see you. So, Dr. Gounder, this farm worker exhibited respiratory symptoms, unlike the first two human cases. So what do we need to know about this one?
Well, what's really important here is to understand that if it's respiratory, it's easier to transmit onward to other people. So if the virus is just in the eye, that's going to be harder to pass on to others. If it's in your respiratory system, you're coughing, it's going to be easier to spread around.
So who is at most risk of getting bird flu?
Well, the risk to the general public is still considered to be very low by the CDC. However, we do know that farm workers are being exposed very heavily. And so if somebody is a farm worker, especially if they're working with dairy cows, they are at risk for H5N1 bird flu.
So we need to keep pointing out that this was cattle to human, but there has not yet been a case of human-to-human transfer of bird flu. But is that something you worry about?
Well, that's an important distinction. So, yes, so far, all the cases have been cow or some other animal to human, historically speaking. We are not aware of any human-to-human cases ever having occurred. But that is precisely how you get the next epidemic or pandemic, is if the virus mutates, adapts to humans, where it can spread human-to-human.
And if that were to happen, do we have the capacity to manufacture vaccines to combat that?
This is a big concern because our flu manufacturing is based on eggs. Bird flu kills birds. Birds lay eggs. So your whole manufacturing process is really in jeopardy potentially from the very virus you're trying to combat. So we really do need to develop alternatives to the egg-based manufacturing.
All right, Dr. Celine Gounder, always great to have you. Thank you very much.